here is our host, Tian Wei.
Hello and welcome to the Frontline Virtual Town Hall, a World Insight special production on COVID-19. I'm Tian Wei. China will lift the lockdown on Wuhan starting Wednesday, marking a hard-earned milestone in the global battle against COVID-19. Today, we are joined by frontline doctors, local residents, as well as foreigners who consider Wuhan their home. They reflect upon months of hard battle and to look forward to the next stage of life in Wuhan and beyond. I'm so glad to be joined by Steve Peterson from Minnesota in the United States. He's now in Wuhan. Xu Beibei, professor at Huazhong Agricultural University, also in Wuhan. Sabi Couscous, Muhammadu Naziru, who is the PhD student in world economy at the Zhongnan University of Economics and Law. John McGorry, an author at the American Speech Company. Meanwhile, we are later to be joined by frontline doctors. They are Cao Wei, a physician of infectious diseases at Peking Union Medical College Hospital, and also Zhou Ning, a cardiologist from Tongji Hospital based in Wuhan. First, let's join by four people who experienced isolation in Wuhan but now has been surviving and certainly thriving. Now I want to introduce Steve Peterson, Xu Beibei, Sabi Couscous, and also John McGorry. Hello you guys.
Yes.
How are you? Let me start by asking Beibei. Beibei, I know you're a teacher of English at your university. You started online courses already. Tell me more about your course. What did you teach your student?
Yeah, I'm teaching like a media English and also modern Chinese.
Okay.
Yeah, and so we started this online teaching ever since the lockdown, right after the Lunar New Year. Okay, and it has been like the 9th week from the start of the online teaching.
Sounds like a lot. Are your students encouraged?
I hope so.
I guess they would say so, at least in front of your face, right? During the online course. Let me also move on to Sabi Couscous, coming from Benin. You were trying to help the local community at the most difficult times. You're also trying to help many of the students, bringing them the face mask when the school were having plenty of them and try to distribute. Tell me more about your experience in Wuhan during the lockdown days.
Like the first day I saw in the morning, I woke up and they sent a message like, oh, the city is going to be locked down. By 10 a.m., I was like, what? No, that cannot be happening. Mm-hmm. But it became so true when our university, the Vice Dean of International Education School came to our dormitories and he came to pick me up. He said, Couscous, okay, this is the situation. And now I need to ensure that everyone is doing fine, and I need to make sure that you have the necessities. Like first of all, you need the hand sanitizers and the mask. Everything started there. It seems like everyone was on board, like without even having a formal meeting of anything. Like,
I see.
Everyone said, okay, let's do it.
Let me go to also to Steve. Steve, I know you marry a person in Wuhan, so you stay in Wuhan. Wuhan has become your home. I want everybody to take a look at how you've been trying to both kill the time and to support the family during the lockdown by doing cooking and baking. Take a look at this video.
Okay, hello, we're back.
Very skillful, I have to say, Steve. You are a great apple pie. You're bringing American flavor to your local Wuhan table.
Yeah, I was here and
Many of my friends, of course, were here, and they were locked down. And some of my friends were maybe not such good chefs with Western foods. So I would, like many people, we were posting pictures of our dinners and our lunches and our breakfasts because we were in lockdowns. And finally I said, well, maybe you guys want to try some cooking of the foods that I cook. So we started making videos and putting them, sharing them with friends. And it was something interesting to do. Yeah, it was very fun.
It looks like a great American apple pie. I'm sure you're going to share your stories a bit later. And also we have with us John. John has a different experience. He stayed in Wuhan for a long time. Later, he decided to go back to America. John, I know you're joining us from Columbus, Ohio. When you hear now that the lockdown in Wuhan will come to an end, the city that you've been working and also having many friends, and certainly I know you're concerned about them over the past few weeks, but what about that news to you?
Oh, that's great news. I'm really happy I know the people of Wuhan have worked really hard and have done everything they possibly could to, to end the virus as quickly as possible. And, I've heard many of their stories, and so I'm just nothing but happy. And it gives hope for the rest of the world that, we can get past this.
Well, someone who's writing to me on the Sina Weibo account, Nick, who is wondering how you guys managed to get through these hard times, especially as foreigners, when the situation was seemingly uncontrollable at the first stage of the epidemic, how they assure their parents and relatives after making up their mind to stay in Wuhan. Maybe on that question, I would ask you, Couscous, coming from Benin, what was it like for you at the very beginning?
First, before the outbreak, I was the representative of our international students in our university. So when this happened, there was no way I was going to leave everyone. I felt like, okay, in hard time, if I can leave them, so I don't deserve to be representing them. So there was no choice for me. I didn't even think about it. So it was clear for me that I was going to stay till the end of the battle.
And you did, and you see the victory now. I mean, at least the lift of the lockdown. Congratulations. Yeah. What about for you, John? You stayed a long time, but then eventually you decided to leave. But, what was it like during at least the first stage of the epidemic when you do not know much as to what to happen next?
Oh, obviously it was very frightening. Not to know, how pervasive the disease was, how much it was going to spread. I felt fairly safe at John Hopkins University, where I was working for 6 years, because we were pretty isolated. So, but Wuhan being a city of 40-story condo buildings, I was concerned that it could, that something like that could spread rather quickly. So, obviously we just had to ride it out and hope for the best.
Hope for the best and work for the best. That's exactly, yes, exactly. That's exactly what Bebe has been doing. I know from my producers that Bebe, you've been living with your grandparents. And, over the past few months, you've been taking care of them.
To be exactly, it's my girlfriend's grandma.
Okay.
First of all, we got quite worried when ever since the lockdown, and then we worry about the food supplies. So we worry about this kind of infection. But I try to keep my grandma calm. She watched TV news every day, but the situation is getting better and better. So we have confidence in spending our lives at home and get isolated. So we stay at home watching TV and talking about life of grandma and grandpa, and we also did some housework together, and the the ultimate goal is to keep isolated, to not go outside. Yeah.
But it's tough, isn't it, to remain at home for 2 months?
It was quite tough, but like, the community helps a lot, So we have community officials and also volunteers who help us, build these group purchase WeChat groups so that we don't have to worry about the food supplies and also those kind of daily necessities. We order things online via kind of a WeChat group, and then they bought it in bulk, and then producers will deliver them to the community. Okay, and they ask us to go downstairs to pick up our order, but one by one, not in a kind of mass. So in order not to get infected.
I think that probably answered the question coming from Sandra WH, who has been asking what kind of support that the residents in Wuhan and also the communities in Wuhan would get. I think, Bebe, you answered part of the questions. And let me go to you also, Couscous. How did you manage to survive those months? I mean, stay at home, and now for you, stay in the dorm. Not an easy thing at all. I mean, for the young people, it's so tough. And you see the lockdowns in other countries, people are having a hard time trying to obey the strict rules. What was it like for you? Any advice for you for them?
Well, I would suggest, I would suggest them to start thinking about what they want to do after the epidemic, because that's the only thing that can keep you going. For example, I'm a PhD student, I'm a researcher. So obviously after the outbreak, I will have to write papers, publish articles. So, that's not a good thing, but because of the outbreak, maybe now I have more choice, more topic to write as a researcher. So it's a good thing for me, and I can focus on that. I cannot only focus on the negative side of being locked down.
You need to have hope and make sure you have plan for the hope and what's next and try to do it during the process of quote unquote lockdown. And Steve, I want to come back to you. Earlier, we already see you making apple pies, but you cannot make apple pies 24 hours a day. So what was it like for you in the lockdown? Now we can laugh at it, right? I mean, the hard time has been in our past, but still during those times, extremely difficult. Tell me how you try to manage it.
It was somewhat difficult because I don't understand the Chinese television, and but I can say that the community was very helpful with getting us food. I had great support online with my friends here that were also in the same situation, and it was a situation where you had no choice. It was either try to be happy, try to occupy your time, play some music, practice your guitar, do different things. And you just made the best of it.
Talking about guitar, we're gonna let you to play a little bit of your music at the end of this discussion. We're gonna leave it for the last minute, by the way. But for now, also, John, even to hop on that plane to go back home to America, it was a difficult choice for you. And also, I know there were a lot of saga in order to obtain a ticket in order to get onto that plane. Even getting back home, you also have suspicions and curiosities coming from neighbors about what you went through and whether you are healthy to be with. So, John, what was it like for you while you were also thinking so hard about your friends in China?
It took me from the moment I left my apartment in Wuhan to the time I got to San Diego, it was 37 hours. And yeah, you're on a plane with, 200 people, probably 50, 60 small children. You knew some people were not feeling well. So there was a lot of struggles, and you're torn. I felt bad leaving my friends behind in Wuhan. I felt somewhat like I was leaving them behind. But we soon found out that we're all in this together. People in Wuhan and people in Columbus, we're all on the same boat on this. We all have to, we're all concerned about every people that we love, and so what I'm doing with my time, I'm writing a book about it. I'm sort of devoting my attention to, thinking about,
I see,
what's gone on in Wuhan. and also hear back more about Wuhan though.
Yeah, I know that your state now, Ohio, is also claiming the emergency because of COVID-19.
Yes.
We hope for the best of the people there. Do extend
Sure.
our greetings to them and
We
our
appreciate
appreciation for their support for us as well. Steve,
Sure.
but you decided not to go. What do you make of John's choice, and what do you make of your choice to stay?
Oh, there was a lot of different thought process put into that because I just arrived back into Wuhan in early January. And where I'm from is a very, very cold state, so I wasn't too eager to stay there. When I came back and then things started to happen, like you had mentioned, it was a little bit difficult to obtain who do you talk to about getting a ticket and what's going to happen if I go home. And there was also, like John said, the leaving people behind in Wuhan. I felt like I would be abandoning me, my family and my friends. And I have several expats friends here that said, no, we're going to stay here in Wuhan and we're going to get through this together.
Yeah.
And at that point, I just decided, not knowing it would be 2 months, but I just decided, no, we're going to stay here with my wife and her family, and we're going to get through this. And yeah, so I still think it was a good decision. I'm very happy with what I decided to do.
I guess
Yeah,
now.
and I just want to say about that, about myself, is that I had already resigned. I was going to come back to America and deal. I've got 4 grandchildren. I was going to come back, so I was going to leave, and then all of this came. So I didn't. My visa was up. I pretty much had no choice. I had to come back to America.
Got it.
So.
Talking earlier about the early stage, there were a lot of rumors, there were a lot of fake news, and you're trying to get the facts. Now, that is very crucial, particularly at the beginning of an epidemic. People are confused. But to know the unknown is important because that will get away at people's fear. So tell me more about how did you manage to do that? Maybe I also get Couscous also thoughts about that too. Bebe.
You know, there are kind of like rumors around the web, and I think the most important thing is to listen to the authorities. And we get news, the reliable source is the TV news. Okay, so just believing those kind of statistics. And there's kind of like a various kind of rumors, very silly ones even, but some people believe them. But I think you need to be sensible before making a judgment, right? Okay, so some of them are really ridiculous. For example, like toilet paper can be used as a mask to prevent, the spread of the virus. That's ridiculous. Okay, so think more about it, and you'll find them. Okay, both of them are not really trustworthy. Okay, so and also we talk a lot online in some university alumni network. Okay, we have also WeChat groups. So we discuss about these rumors, and some of the alumni are professional guys, and they help us understand that these were rumors, not truth. Okay? They have like a better professional judgments on it, so we get better news from them.
Professionals, use your common sense. That's the way to go. Is it, Couscous?
Well, when it all started, there were a lot of fake news, rumors, but the most important thing was to keep your head cool. We, like Bebe said, in China, WeChat is very important. So in our university, to organize the prevention, we had to create several WeChat groups for students. For the one that are traveling out of Wuhan, the one that are staying in campus, and the one that left China already, because the school has to manage all of them at the same time. So there were rules in the group. We are like a big family, so the teachers will try to explain to us these are fake news, and in this kind of time, people are scared, and some people try to make a living out of it. They're trying to create a chaos out of it. So you have to keep your head cool, and if there is anything you want to talk about, you can write in this group and share with us. We will tell you if it's fake or not, and we are sending you the official website where you can get the news. And every single day, the university will also send us news about the numbers. So in our group, we basically follow China daily, Remin Ribao, and these kind of papers information.
Got it. So you, in a way, get it disinfected, the rumors,
Yes.
right? Through
Yes.
the communication with the others. That's a good way to go. And keep your head
Yes.
cool. Very great advice. I also want to ask John, there is one question for you. How, it's from Weibo once again, from Shang Liulian. It says, how does John in America feel? Does he have enough protective gears? We are worried about you, John. John, your response?
You know, it's so much different here in America. When I was in Wuhan, everybody wore masks all the time. You know, anytime anybody went outside, you had to have a mask. In America, they have not done that. And so, you know, they try to save the mask for the hospitals and the caregivers. So, you know, generally, you know, we don't wear masks. I have some, but I have started wearing one. Now they're starting to come around to more the way the Chinese operated. Wear a mask, it's safer.
Yeah.
But there aren't enough masks for all the people here, no, without question.
We understand that there is a shortage of medical supplies there, but I think it is recommended now by the US CDC to wear a mask. So I guess people want to know how you're doing, John, from this part of the world, and we hope we will be able to help you if you need some help from this part of your friends. Thank you very much. And where can you see Steve coming back? Steve?
Yeah, I had family members here that were ill, and I'm so happy now that they've all recovered and they've all been released. And I think some of them now, even though, and in what I've seen, I really have a great appreciation of how things were taken care of. My niece was very surprised at the isolation hospital and the good food every day and the good care. So it really raised my respect level. And I've always had a lot of respect for China, but it was a wonderful thing to see, and I'm so happy that everybody recovered so well and now is doing just fine.
Yeah.
Yeah.
You know, there are a lot of things we could have in mind, and also to communicate with one another. Time is very limited. I know every one of you who has gone through 2 months of very different experience of quote-unquote a lockdown in the city will look at things, yourself and life, possibly in a relatively different light. So I want to ask you, without being philosophical, you know, what are you looking forward to after Wednesday when the so-called lockdown in the city will be lifted, and you can feel free to travel, you can interact with your friends, not just online like we do now, but offline, in real person, even though you need to still have the mask on. What is it gonna be like for you? What do you want to do most? Baby, you've been smiling when I'm asking that question. It seems that you have a lot to share. You only have 1 minute and less to share. Okay, go ahead.
Okay, I just feel relieved, and then I just want to meet my girlfriend in person. Okay, it has been like 2 months since our last meet. Okay, so I really want to meet her. Okay, I love her.
We wish you the best, of course, to that sweet moment. I'm already feeling it for you. Couscous, what about for you?
This is like an early birthday gift for me, as 7th of April is my birthday. So I'm quite happy that on 8th I can go out. But most importantly, it's not about the going out. I love playing football.
Yeah.
I want to be able to play football very soon. I know it's not possible for now, but very soon I hope I can do it. Most importantly, I want my friends, the teachers from International Education School, which I consider like family, to be able to come back, and so that we can go to class and I can be with my friends, because that's the most important thing.
John, what about for you?
Well, now that I'm not in Wuhan, I'm going to be in lockdown probably for another at least 1 month, if not 2 months. So, you know, lockdowns just won't end for me fast enough, because it could very easily be summer before, you know, this really, you know, goes away here in the United States. So I got a much tougher road ahead of me, and I wish, you know, I feel happy though for, you know, all the other people here today, and you know, I'm happy for my friends from Wuhan. I know they've been through a lot. So
we will cheer for you when you stay put in Ohio, because after the hard time, there will be safety. Okay, there will be safety and health. So you have to stay put for the hard time. After that, think about the beautiful things after that, okay?
Oh, I
John,
will. I
yeah?
will. I'm an optimistic person, so I'm expecting. I think we'll all come out of this a lot stronger as a human race.
As long as we're united, we will be there.
Yes,
Yes,
correct,
exactly.
correct.
Last, Steve, you better share something with us. What's your plan, after Wednesday?
Mostly I will just be just going outside, taking long walks, exercising, walking along the river, getting together with friends right away. To be honest, I'll be a little skeptical about that. Maybe distance myself, even though we're free again. But it's going to be nice to see the optimism in Wuhan and the happiness of other people to be getting out.
Mm-hmm.
And I'm probably just going to go for nice long walks. Let's go sit down in the park and just enjoy the outdoors and the sunshine and the idea that you have freedom again.
Anyone who had the experience of living indoor because of COVID-19 knows exactly, Steve, what you're talking about. The air to breathe, the sunshine, and the little wind going through the breeze of the willow tree, by the river, the glimmering river and the water. That is just something very touching. We want to thank you for that. Stay with us because we're going to be back after this. We're going to leave you with the beautiful music coming from Steve. He promised us earlier he's going to play some music. Want to thank Steve, Bebe, Couscous, John. Stay healthy. All the best to you and your beloved ones.
I've been throwing horseshoes over my left shoulder. I spent most all of my life searching for that four-leaf clover. Yet you ran with me, chasing my rainbow. Honey, I love you too, and that's the way love goes. That's the way love goes, babe. That's the music God gave for all the world to sing. It's never old, grows.
In this episode of Travelogue, I discover what makes the Chongqing lifestyle so unassumingly special and how it's evolving and modernizing along with the city.
You're watching breaking news on CGTN.
Watching CGTN with the latest market-moving headlines from around the world. Welcome to the world today on CGTN.
The world is changing fast, taking all our lives with it. But we can change it too, by seeking answers to problems through discussions and debates. On World Insight, I ask direct questions to real people in the know, seek genuine answers, but respect diverse perspectives. Our live global debates tackle the most critical issues head-on. World Insight with Tian Wei go beyond the headlines. Welcome back. Now you are joined by two doctors fighting COVID-19 on the very front line in Wuhan. And this is our special program, a virtual town hall celebrating the lifting of lockdown of the city of Wuhan. We have Cao Wei, a physician of infectious diseases at Peking Union Medical College Hospital, and also Zhou Ning, a cardiologist from Tongji Hospital based in Wuhan. Great to see you, Cao Wei, by the way. And I love the hair when you have it down like this, because earlier when I met you, when I talked to you, you were busy at the hospital and you were tying your hair up. So now, tell me, what is it like for you to see Wednesday coming, the end of a lockdown?
I felt very pleased and happy. And after so many days of fight, we finally wait for the day. But it's not the end of the COVID-19 fight in China. We still have to keep our eye on and be alert for the future things, to see how things will go.
Yeah, let me just mention to our audience who are watching this live right now, Cao Wei has been sent from Beijing to Wuhan. Actually, she volunteered to go there. And she has been busy from February, if I remember right, in the city of Wuhan and still stayed there until today, even after most of those doctors and nurses coming from other cities have left Wuhan for home. So my salute to you, Dr. Cao, for that. And also, let me go to Dr. Zhou. Dr. Zhou Ning, good to see you again.
Thank you for the invitation.
You know, one of the things I got to know you is because you were earlier infected by COVID-19. After survived the epidemic yourself, you came back to work and work at the ICU, the toughest place in the fight against COVID-19. So tell me more about what does Wednesday lifting of the lockdown mean to you?
That means I'm free. So, you know, as the lift of the lockdown of Wuhan city, we already finished I already finished my job and my works in the ICU ward of the COVID-19 patient. And now I'm in a 2 weeks quarantine, and then if I am healthy, it means I'm not affected by the virus, I will go back to my general regular work in my hospital.
How many days do you still to have in the quarantine? How many days more?
No, another 10 days. I already have finished 4 days, and then another 10 days.
Okay, 10 days to go, right? You were gonna see your families. Wonderful, wonderful.
Yes.
But tell me more from both of you. What was it like in the hospital? What is it like now in the hospital of Wuhan, where you are? Let's just go to Dr. Cao first.
I'm actually working in the Sino-French campus of Tongji Hospital, and we are managing the patients in an ICU department. So right now, although most of the patients have already been discharged from most designated hospitals in Wuhan, we still have about 300 also critically ill patients in the whole city of Wuhan. And we are still having patients in our department. So basically, we will continue to take care of them, and hopefully part of them will have the opportunity to recover.
Okay, and what about the severely ill patient? Are they having a bigger chance of surviving through the ICU and through the treatment? Dr. Cao, very briefly.
We will try our best to make every effort for them. But once the patient has entered into the ICU, a proportion of them actually are at a very critical phase. And actually they are facing a high incidence of mortality.
Yeah. Dr. Zhou, I know you were also earlier before this working in the ICU. We all know the death rate in the ICU could be 50 to 70%, no matter which country we're talking about right now as a result of COVID-19. So what is your biggest worry and concern at this moment for your patients?
Right now, our hospital is already closed because all of the COVID-19 patients are already transferred to the Sino-French city campus of Tongji Hospital. That's where Dr. Cao working now. So we already finished our job. so far. And my concern about this patient is the treatment of this very severe, the critically severe patient in the ICU ward. You know, the key to reduce the mortality rate of the COVID-19 patient is our work in the ICU ward. That's, you know, most of the deaths is came from the ICU ward. So that's the problem. That's the key to reduce the death.
We have questions coming from our viewers, both online and also throughout our social media platforms. For example, this is Luo Bin Peng Gary coming from Weibo asking, as COVID-19 is under control nationwide, lots of citizens from Wuhan will leave Wuhan or go back to Wuhan to resume their work. Should there be discriminations against them as a result of being from the epicenter? So maybe Dr. Cao, you want to take that question?
Actually, people are gradually getting back to work and maybe later to school. And the society, the life of society will gradually go back to normal. And during this phase, we still have to pay attention to what we have been practicing during the past 3 months. Pay attention to our hand hygiene, keep social distancing, and also wear masks when needed. Still have to pay close attention to our own health, because although the domestic cases has almost decreased to zero or about the error level, we have probably noticed from the news that the imported cases and most importantly imported asymptomatic infected patients should bring huge challenge to the whole society, to the current status of China. So we should keep close eye and be alert for that.
Right. Asymptomatic cases as well as imported cases are the biggest concern so far. Dr. Zhu, your thought?
Yeah. As you know that the local cases in the community is less and less. So the most concern is from the cases from abroad. So my suggestion for the Wuhan the residents is to protect them and their family well. And so far, the isolation is also a very good method to protect them. And secondly, our hospital and our government should strengthen the screening of the people who came back from the other epidemic area, like New York, like the Italian, like this place. And also, we should keep a very close eyes. I mean, to have a very broad detection about the people who have a very close contact with the confirmed cases, like our medical staffs. We are in a very high risk to be exposed to that cases.
Right.
So we need to get a repeated virus test before we go back to our community, go back to our house, go back to our working place.
What does that mean for you the past 2 to 3 months when you were dealing tirelessly every day with the COVID-19, dealing with people who are on the verge between life and death in the ICU, looking at the paramount number of confirmed cases, I mean, at least compared to the other diseases that you experienced before in such a period of time. What was it like for you professionally, Dr. Cao?
For me, actually, I'm a physician of infectious diseases, and this is just what I do. Maybe slight different from Dr. Zhou. This is a brand new disease and a brand new virus. So during the process of the past 2 or 3 years, it is also a process that we get to know the virus. And it is kind of desolating at first, because patients are dying in front of you, and when we don't have enough experience for that. But with time going, you get to know more and more, and you observe the patients at the bedside, and you see different patients. You gradually get to know how the disease is progressing in different populations. And then finally, you may find 1 or 2 key points of the disease. And at that time, you may find some ways to manage it. And seeing people are improving from what you have done, it is a great sense of success.
What were some of the things you noticed over that period of time, and what solution did you provide?
For example, from most of the patients, you will observe that they have a certain pattern of disease progression, like in the first one or at 1 week or 10 days, the patient being mildly fever or mild course of upper respiratory syndromes. But then in the second week, if the patient's going to deteriorate, it will start from the second week. So this time period should be the most important opportunity window that you can do something to stop the progression of the disease. That's just one example of how we find.
What about for you, Dr. Zhu? You are a cardiologist, but you eventually worked in the ICU because I think you probably have developed some kind of antibody because you had it already, right? So what was it like to have this professional change? And what does that mean for you also as a doctor, this very different and difficult time of experience?
So I learned a lot in the past 2 and 3 months because this is a brand new virus, is brand new pneumonia and a kind of infectious disease for all of our medical doctors. So actually, I learned a lot. I and my team and myself get some experience about this virus, and we did some ECMO work. You know, the ECMO is maybe the last choice for those very critical ill patients. And yes, our team did to save some patients.
I want to wrap up today's program by thanking the two of you, Dr. Cao Wei and Dr. Zhu Ning. Dr. Zhou Ning, you and your colleagues, Dr. Cao, you and your colleagues have been working around the clock to save lives. I think the city of Wuhan, thank you, and the country of China and the world, thank you for your tireless work. We see now medical workers on the front line in different countries around the world are working as hard as you are. We want to salute also to them as well. Thank you very much, Dr. Cao Wei and Dr. Zhou Ning. And that's all we have for today. To find out more, you can always try to find us World Insight CGTN into your search engine. Check out our YouTube and Twitter accounts, as well as our Facebook account. From me, Tian Wei, and everyone on the team, thanks for watching. And thank you for your solidarity and support throughout the past few months in our fight against COVID-19. Bye for now.